I remember when I was queer and living in Ontario, and I had a doctor who was South Asian, a South Asian female doctor, close to my age. And we were talking about pap smears or pap tests, and she was trying to convince me that I should have a pap test every year. And so I said to her, well, I thought that if you have normal pap tests for a few years, then you don't have to have them more than every 3 years. And then she said to me, well, you're not in a stable relationship. And she meant that I was not in a monogamous relationship, and I was queer, and I was slutty, and I was fine with that, and I was actually quite on top of my sexual health, which I think is really important if you're slutty. And so I felt really angry about the way that she framed me. I also thought, well, you're not doing a very good job of providing like good sexual health services to your patients who are in so-called monogamous relationships, because what if stuff's going on that they don't know about? Like, there's just so many assumptions. Like, I get asked about my husband all the time in healthcare, because if I mention that I have a son, that they just assume that I'm married. And my reaction is like, ew. Because whenever I think about having a husband, I'm like, ew. But they ask me just like, not even do you have a husband, but like, so what does your husband do? It's ridiculous and annoying.